Hello, I'm Philippa from Kangatraining Cairns Nurtured Fitness, and I'm here today again with the lovely Megan from Phyx Physio and Rehab, and we're going to go quick chat to you today about abdominal separation, also known as DRAMS, which is really common during pregnancy. So, can you tell us what abdominal separation is and the effect on a woman's body?
Sure. So all of our tummy muscles come and join onto one central point, and it's a fascia point, and that's where our separation happens. For pregnancy, for a single birth, 2 to 3 centimetres of separation is normal because these muscles have to expand and contract, okay? What we see is that often our fitter women can actually get more because their muscles are tighter to begin with, okay? So they don't have that stretch that some people with less tone may have. And what the effects are with that is that it really weakens the core and puts pressure on the lower back post-birth of bub. So during pregnancy, no problems. There's also some genetic link, just like if you're lucky enough to get, stretch marks or not stretch marks. Some people get real big separations and they think it's got a genetic component. Yeah.
Awesome. So DRAMS can affect a lot of women. Is there anything during or after pregnancy that can make it worse?
So during pregnancy, research states that if you do a lot of heavy lifting tasks, you can make it worse. Also if you're doing a lot of crunches, because remember what I said about athletes and fit people actually having that problem more so. So if you're keeping this really, really strong core during your pregnancy and you're not letting it stretch and expand by doing crunches and sit-ups and things all the time, then you can actually make it worse. Post-bub, okay, if you have that separation and you need to have that measured, and we'll show you a little bit later on how you can do that, then you shouldn't be doing tasks that are letting that abdominal contents fall down onto your tummy muscles. So planks, push-ups, those sort of activities, because it's going to be separating that because all your abdominal contents is pushing on it. Also, we should not be doing plain and simple pure sit-ups or crunches. To begin with, we need to hold together those muscles to do it. So a therapist or someone like Philippa could show you how to do the correct exercises.
Yep. So does it ever go back to normal?
Yes, yep, it can. And I've had lots of mums that come to me years post and they finally figured out that their back pain is related to having separation, and if they do the correct muscles, okay, do the correct exercises, it can help those muscles draw back together.
Awesome. And what things will help us heal it?
So the exercises we need to concentrate on are specific in holding that together at your level of where your separation is, so that can be shown by your instructor. The other things you need to really remember doing is getting in and out of bed every time on your side, okay, so you should not do a full crunch sit-up as you get in and out of bed. Doing your pelvic floor, there is some link between strengthening pelvic floor and helping all of that core muscle stay together and being tight. So pelvic floor exercises are going to be different to the ones for this separation. And then you should just also again watch really heavy lifting. The research states nothing heavier than your baby, but a lot of mums have a bigger child and they have dogs and all these other things we have to lift shopping. So really just avoid heavy lifting or returning to exercises too quickly if you have that separation. And as I said, push-ups and all those ones where we're face down in that prone position are a big no-no if we have some bad separation. Until it's down to 2 centimetres, then we can start doing those things.
Awesome.
Yeah.
So it's really important to get your separation checked, and you can either get that done with me at Kangatraining, come see a Womens Health Physio therapist, or even your GP can check it. So just ask next time you come in. But we're just going to show you quickly now how you can test if you've got any separation yourself at home.
Yep.
So, shall we get you on the floor?
Yep.
And I'll move this around.
Yeah, yep. Just move that around.
Alright.
Come down, have a lie down on the floor. So what we do as a therapist is I would be the therapist standing above, and I'd be putting my fingers between your breastbone and your pubic bone and going all the way down through there to try and feel if there's any areas of separation. So all I do is start here and I say gently lift your head and shoulders up off the floor, and then I push down to see if there's any separation. So at home you can do this with your fingers pushing down in between where your abdominals are, okay? Just to feel if your hands actually go through your abdominal area, and you'll feel it if you've got it. So as you're up, pushing down through, do your fingers stop right in that middle section, or do they go down through, okay? And we measure by how many finger widths we've got going down through that stomach, and that's how many, 2, 3, 4, 5 centimetres, whatnot.
Cool. Awesome, thanks so much, Megan.
That's okay.
So, I'll pop this back up here. But yeah, if you do have any more questions about abdominal separation, come down to Phyx Physio and they will help you out. They've got some great women's health physiotherapists down here.
And it can just be a quick assessment, show your exercises, you can go back to your gym program. It's not like you need a lot of physiotherapy for it, it's just knowing A, how much separation, B, where it is, and what have you got to do to fix it.
Cool.
Thanks, Philippa.
Cheers.